poverty and some strategies to help families build financial security with Corey Hattemer from CFED, a national organization that creates pathways to financial security and opportunity. For those joining us on the webinar today, following the presentation, there will be time for questions and discussion. You can ask a question at any time by typing your question into the chat box on your screen. Today, I am very pleased to present Marissa Parisi. Marissa is the Executive Director of Hunger Free Vermont, a national leader on outreach, advocacy, and education on ending hunger and malnutrition. Since joining Hunger Free Vermont in 2009, she's helped to grow the organization, and she's included outreach on senior nutrition. She's increased nutrition education programming and expansion of the hunger to councils to 5 counties in Vermont. Marissa has a Master of Science degree in Human Services from Springfield College and recently completed the Senior Leaders Program at Columbia Business School. She's a member of the Governor's Council on Pathways from Poverty, chair of the Vermont Women's Fund Council, and on the corporate board of Northfield Savings Bank. Marissa's talk is titled, Ending the Justice of Hunger and Malnutrition in Vermont. Marissa, welcome, and thank you so much for joining us.
Thank you, Paul, and thank you everyone who's called in today, and for those of you who are here in person, welcome everyone. So I know that you've already had a number of presentations. You may have been to some presentations about ending poverty in Vermont and also a presentation about food security, but I'm hoping to kind of tie all of that together today and give you a sense of how Hunger Free Vermont is working to really get at the root of the problem and make long-term systems change that really provides food and nutrition to our communities on a regular basis. So I sort of like starting my presentation grounding folks in what it's like to live in Vermont. And I know we all know what it's like to live in Vermont, but particularly low-wage workers, what it's like to live and work in Vermont. And just one second, I'm just trying to move through our PowerPoint here. Here we go. Good. So I have some numbers here I'm going to go through. And these numbers are based on a couple things. They're from the Joint Fiscal Office in Vermont of the costs of a family of 4 living in Vermont, and these numbers are based on a rural area, so they're not necessarily Chittenden County numbers. And also, we've confirmed a lot of these numbers with clients that we work with, clients who are on 3 Squares Vermont, people who are applying for free school meals, of about the cost of what it costs to live in Vermont for a family of 4. So the total that we've come up with for these really just basic expenses, so housing, food, transportation, heat, child care, and health care, comes to about $4,243 per month for a family of 4 to meet their basic needs. Now, I just want to note that in this budget I have in front of you, I haven't included anything for savings to create a safety net for the family. There's other expenses such as dental costs. If you have 2 children, you know the costs that come up. Sometimes it's, here's the $25 to go on that field trip, the sneakers the kids really want. So there's a lot of expenses outside of these numbers that are in front of you. But really, just to meet your very basic needs in Vermont, we came up with a number of $4,243, again, based on the Joint Fiscal Office and confirmed by a number of the clients that we work with. So I wanted to break this down a little bit because in Vermont and nationally, we just had a very big discussion about minimum wage, and some changes were made. Nothing has moved at the federal level, but we moved a little bit in Vermont. But I'm just going to share with you the numbers that we were discussing in Vermont during the legislative session about the minimum wage. So first off, this is the minimum wage in Vermont right now, $8.73 per hour. So we actually did some numbers based on our own payroll system at Hunger Free Vermont, what it would cost if you didn't have your health care connected in this. You know, it's just, this is your taxes, your federal deductions. You come out with 2 full-time workers at at a negative $1,884 a month if you have 2 full-time workers right now working 40 hours per week in a household earning the minimum wage in Vermont. At the federal level, we had a discussion about how we could perhaps increase the minimum wage to $10.10. And again, if we increased it to $10.10, this family of 4 living outside of Chittenden County, working full-time, would be a negative $1,147 each month. And lastly, we had a discussion in Vermont of how could we potentially get to $12.50 an hour in Vermont as our minimum wage. And even at that rate, this family would still be just about $500 negative every month. So you can see how working families are really struggling to meet their basic needs and how hard it can be to purchase food. Because in this budget, as you can see, food is $995, which, given that the cost of food continues to go up, I really have thought about that number, and I think it's really not unreasonable. Think if your 2 kids are 2 teenagers, how much food you're serving. And I'm sure many of you have teenagers at home and are just nodding along with me right now. It's very expensive to feed a family. So that budget tends to be the most flexible. You can't get away with not paying your housing. You can't get away with not paying your transportation. You absolutely can't get away with not paying your heat. You need child care to work. Health care is essential. Maybe people are going without health care, but we hope not. But food really has a flexibility that other things in this budget does not. So that's where we start seeing hunger and malnutrition in our homes in Vermont. So let's talk a little bit about hunger in Vermont. I'm going to share some statistics. All of these are from the USDA, who contracts every year with the U.S. Census to measure food insecurity. And what the federal government defines as food insecurity is not having enough financial resources to meet your basic nutritional needs on a daily basis. So we just saw that in the budget. Now, what are those tight budgets doing to our Vermonters? We're in a position where 14% of all Vermont households experience some form of food insecurity. So that's 1 in 7. That food insecurity can look like buying inexpensive food that are high in calories, high in fat. The least expensive food tends to be the least nutritious. So they may be buying poor quality food. They might be buying, parents might be buying food where they unequally distribute it in the home, where the kids are eating well, but the parents are going without to feed the kids. And in some cases, this number includes households that actually are skipping meals on a regular basis to really make their budget work. So in these households, 20% of children under age 18 live in food insecure households. So that is a really big number. That means that 20% of our children, so 1 in 5 children, are going to school hungry. They may be not eating over the weekend, but eating okay in the school meal program. This is, I think, one of the biggest risks for the state of Vermont, is that our children are going through their childhoods and not getting the regular nutrition that they need. The biggest risk, and I'll talk a little bit more about this later in the presentation, but the biggest risk we should all be very concerned about is children age birth to 3. Because that's when you're really building the foundation of your brain. And you need good nutrition to have good brain development. And if you don't, not only will you not be ready for school, but you're going to be challenged for the rest of your life. And then just the last note, Vermont, compared to other states in the nation, has one of the most severe food insecurity issues. So when the USDA contracts with the U.S. Census to take these measures for food insecurity, they do a screening where if you score, when they call you, when you score into the food insecurity category or you have children in the home, they ask some additional questions to try to get at the severity of the problem. And that's where Vermont does not score well. We tend to have some of the most severe cases of food insecurity in that category. So that means there are people in our communities absolutely going without food. And that's a big concern. So what are we going to do about it? We've had a lot of discussions, and this slide might look, there you go. it was blank there for a second. But I know you've already talked about the charitable food system, which is an incredibly important system where food pantries, the Vermont Food Bank, our churches, our faith communities offer food in the community that people can go and get when they need it. And right now in the state of Vermont, this is just an estimate because this number is kind of hard to get at, but it's about 19 million, I think maybe a million or two more, a million or two less, charitable food in the state of Vermont. Now, I don't know, some of you may, who have called in, be working in a food pantry or may have a food pantry within your organization, but I think you would say, because I've heard this a lot around the state, that there's so much need coming into your food pantry right now, it's almost impossible to meet it. I really have not met a food pantry yet that's saying, yeah, we're meeting every single need in our community, because especially during the recession, the need has gone up significantly while donations have gone down. You know, I've heard a lot of stories from food pantries saying, people are coming in that used to be donors, and they're really struggling with this. They used to be a donor, and now they're coming in saying, I've lost my job, we never expected it, we didn't save for it, and now I need your help. So the charitable food system is incredibly important, but another opportunity is the use of what are called the federal nutrition programs, which this is actually a number that's pretty accurate. We were able to get this number from the state of Vermont and all the nutrition programs that are operating in Vermont, and there's $156 million coming into the state through federal nutrition programs like the 3 Squares Vermont program, the school meal program, the child care meal program, our summer meal program that's operating right now, where there's this incredible opportunity to get people these resources and be able to have people make choices of what food they are going to have on a regular basis and use those dollars in ways that are traditional and more stigma-free than relying on the food pantry. So that is really where Hunger Free Vermont works. We provide a lot of support to charitable food. For example, we are very good at 3 Squares Vermont outreach, which I'll tell you more about in a minute. So we do a lot of help with outreach on application assistance, that kind of thing. But we really focus on working to make federal nutrition programs work really well for our communities so that people can get food on a more regular basis. So here's the formula Hunger Free Vermont works on. We really think we can have an end to hunger if we make sure children are fed healthful food wherever they are in their day. So that can mean school, childcare, summer programs, after-school programs, wherever a kid is, that there's nutritious food available to them. That then when those children go home, that parents and also their grandparents have the resources, and an example of a resource is 3 Squares Vermont, that are adequate to purchase food for the family. Then everybody who might need cooking and nutrition education has access to it, because as you can imagine, we want our communities to be healthy, so that we hope means cooking more fruits and vegetables at home. We hope that means they're local too, so that we can really support our local economy. But as we're all challenged with, it can be very tricky to know how to cook those fruits and vegetables. So we believe in also providing cooking and nutrition education so that everybody can cook at home. And that when it comes down to it, our charitable food system is not used as the primary source of food for families, that they are able to operate getting people food urgently, getting people in a safe situation with food, but that it's not the resource that people rely on a regular basis for food when they're struggling financially. So now let's talk a little bit about our programs. I just want to say to those of you watching the PowerPoint, all these photos that I have are from Vermont programs. I didn't use any stock photos. I really hope that at some point, if you don't have children, if you haven't been to a school meal program or any one of these programs in a few years, that you consider attending one in Vermont, because we're doing a really good job providing some of these programs, and especially in the school meal category. So 37,000 children in Vermont receive free or reduced price meals. That's kids that are currently enrolled in the meal program, but about 40% of all of Vermont's children are eligible for free or reduced price meals. Something I want to say about school meals is that school meals is really the only place in the school where we separate children by socioeconomic class. So we don't say, well, you get a paid free or reduced textbook, or a paid free and reduced bus ride. But we do that in the school lunch line. And that's a program of the federal government, and they've set up those categories. They've existed for some time. And so what we do is we really help children get into the program and help schools provide really quality programs. But what we were seeing as we did our work over the last 20 years is that many kids in that reduced price category, so those are families I think you would see in that budget I showed at the beginning of the presentation, who were making money, had income, but could potentially be just over income to not have their kid qualify for a free meal. So they would have to pay a little copay for their breakfast or lunch if they fell into the reduced price category. For breakfast, that's 30 cents, and for lunch, that's 40 cents. And we were hearing from schools that they were seeing these children who would qualify for reduced, or they knew would qualify for reduced but wouldn't fill out the application, come through the lunch line hungry. They knew they were hungry. They could see them being sick often. They could see them being really tired. These people all work in the same community. They knew hunger existed for this kid. And so they'd feed them anyway. They wouldn't have their 30 cents. They wouldn't have their 40 cents. They'd feed them anyway. And then at the end of the year, there would be significant debt in the program, which would cause a lot of problems for the school meal program. And it made it so that the school meal program wasn't able to invest more in the program or able to provide more local food. And the schools were saying we can't have you running in this deficit. So the school food service directors were also trying to track down these families for $10, $15 for their kids having eaten in the school meal program. So in 2008, we worked with the state legislature to pass a bill that had Vermont kick in the 30 cents for breakfast for those reduced price kids. So it made school breakfast free. And over a 5-year period, we saw an 85% increase in kids eating in the breakfast program because we passed that legislation. So in 2013, we decided let's really go for this for lunch because we have the data, we know it's effective, and we worked with Governor Shumlin, and we became the first state in the nation to pass a bill that eliminated the reduced price category completely for children. So now any kid that qualifies in Vermont for reduced is free. So in Vermont, luckily, we only have 2 categories, free and paid. So that has made a big difference. We've already seen some schools increase participation in this program by 79% in some cases. So we really knew that families needed this. And the applications have just come flooding into schools. On average, we're seeing a 50% increase in families that thought reduced price wasn't worth it before, but now they are enrolled and their kids are getting free meals on a daily basis. So while we're really excited about this progress, Hunger Free Vermont has this really big goal. Along with I think the White House and many other states who believe that a universal school meals model is really the way to go. And that's what we're going to really work towards when it comes to schools and working to end childhood hunger. And what universal meals means is that every child who attends school receives meals as part of their education. So there's no income screening. Every child would go to school and be able to eat meals. And there's been a lot of research about what universal meals can do. So first, it helps all students have access to the same healthy meals. It reduces student hunger and improves nutrition. I think if you talk to a lot of teachers, they really like well-fed children. It really changes the environment, changes the classroom, helps children be able to learn. It improves student health, learning behavior, and attendance. It reduces the achievement gap for low-income students, and we've seen that firsthand. For example, Milton, that was the picture of the little girl at the salad bar in Milton. They changed the meals significantly in the last 2 years, and their kneecap scores have gone up significantly. And if you ask the superintendent there, the only thing that's changed is the meals. It eliminates stigma around eating school meals, so it's not, even though we have some very anonymous systems in place in schools so that you don't know what category you're in, Go home and ask your kids, do you know if there's a system at school? And they will all say, oh yeah, we know who the free kids are and we know who the pay kids are. It's, you know, because they see little signs about how they put in their PIN number or how often they put their popsicle stick in the bucket, because some schools have more low-tech systems than others. But kids know. The stigma still exists no matter how much we think we're smarter grown-ups and we can implement a system. Kids know. And free up staff time for scratch cooking. As I said earlier, there are really talented food service directors who have culinary degrees, and what we're asking them to do is track down 10 or 15 bucks at a time. We're making them debt collectors, and what they want to focus on is feeding kids good food. So we're hoping to free up more staff time for scratch cooking. So how are we going to pay for this? We are thrilled in Vermont that a new federal program just became available called Community Eligibility Provision. And to keep it as simple as I possibly can, because federal programs often are not simple, if your school has a high amount of kids whose families are in the Reach Up program or in the 3 Squares Vermont program, those children are directly certified into the free meal program. So they don't have to fill out an extra application. They can just be on the roll for free school meals. So if you're in an area where your school has more than 40% of kids being directly certified, you are now eligible to offer a universal meal program through the community eligibility provision and start serving universal meals to all the children in the school. Right now we have, as soon as the provision became available a few months ago, there's 45 schools in Vermont that can do this, and there's 12,000 kids in those schools. So if we work really hard this summer and get as many of those schools as possible, we can start really making a dent. And if you think about it, 2 good meals a day at school for kids, it really alleviates that family food budget, and kids are getting great nutrition. So we really feel like from a public health standpoint, this is kind of a no-brainer. We just need to keep working towards this model and help schools get up and running on it. So summer meals, this is very timely. We're doing a lot of work on summer meals because, you know, as you can imagine, once the school closes, what goes with it? The buses, the programming, and the meals. So right now, 6,300 of those 37,000 children receiving free meals during the school year have access to meals in the summer. And there's over 250 summer sites serving children, and many of these sites are open sites in communities where any kid, regardless of income or eligibility, can go and eat meals in the summer. And this is how you find them. If you can either call 211, or Hunger Free Vermont, through a national partner, offers a texting service where you can text Meals VT to 877-877. It'll prompt you for your zip code and then give you the information on how to find your local summer feeding program. And so, you know, summer is really tricky. So 6,300 of 37,000, it's not a lot, but Vermont's ranking is 5th in the country for being one of the best providers of summer food. And I feel like Vermont being the best, one of the best in the country, is indicative of the lack of access that other communities have around the country around summer food. And as you can imagine, there's a lot of issues. If your school bus goes away, it's really hard to get kids to congregate in an area where they can have summer meals. And that's a lot of what we help with, is finding transportation both for kids or for the food to the kids. Startup funding. The thing about the startup funding is the meals are covered. The federal government, you use this program, sign up for it, they'll cover the cost of the meals, but nothing else. And as you can imagine, you think back to when you were a kid, you wouldn't have wanted to show up to just a place and just eat a meal and go and leave. You would want to do the same thing every other kid is doing in Vermont. You would want to hike, or you would want to, you know, go use jump ropes and play with your friends and canoe. So startup funding so that sites can provide those types of activities so that kids really feel like they're part of a program is really important. But that funding doesn't exist through the federal nutrition program. We need to find that funding in our communities. So there's a lot of challenges to providing summer programs, but we're really working hard towards that. And we work very hard at the federal level also to help influence legislation that can make these programs better and more accessible. One thing I would also say, back to the universal meal model, if your school starts offering the community eligibility provision, it immediately allows you to have a lot more opportunity to serve meals in the summer after school. So there's a lot of great reasons why we would go towards the CEP model, because it affects other programs and makes them more accessible. So, so summer meals is really important work. Child care meals, this is something else I spoke about a little bit at the beginning of the presentation. But this is another place where we have pretty low participation, and we've been working on it for many years. But right now, over 4,000 children eat free meals in child care, which is about 307, well, it is not about, it's 372,651 meals to kids across Vermont. And again, age birth to 3 is a critical time for brain development and growth, and where good nutrition is critical, because you really are building the foundation of your brain that will impact you for how you're able to learn and absorb information and function in the world as an adult. So we really think we can do better with this program. The reason that it doesn't have as much usage is because there's a lot of regulatory challenges. It's a very thick, cumbersome application with very strict eligibility requirements and review requirements, and it can be very challenging to run your business and then meet all of the regulatory requirements within the program at the same time. So this is an area where we're going to really work hard at the federal level with our delegation to try to make changes in how we administer this program in rural states. The Child Nutrition Reauthorization at the federal level that reauthorizes all these programs is coming up, and we're going to work really hard to offer suggestions on how we might change this program to make it more accessible. But it's really critical, and the programs that are doing it are doing a really great job. This little guy is from a program in Burlington who really worked very hard to figure this out, because they were seeing things like children coming to child care with a lunchbox that had 2 donuts and a soda in it for the whole day. They were just seeing a lot of nutritional challenges with their parents, and it wasn't that the parents weren't trying, it was all they had. So now this child is able to go to his child care center and have 2 meals a day and snacks that all meet the federal nutrition requirements that include things like dairy and fresh fruits and vegetables and whole grains. So 3 Squares Vermont. 3 Squares Vermont is also known as SNAP nationally, or food stamps. In Vermont, I think we have one of the most creative names for our program. Other states also tell me that they think we have the most creative name and that they love it because it feels very Vermont-y. But the 3 Squares Vermont program is the largest federal nutrition program we operate in the state of Vermont and in the country. And it's one of the most effective interventions in ending hunger. Right now, over 100,000 Vermonters use 3 Squares Vermont. So that's 1 in 6 Vermonters use 3 Squares Vermont. And an example of an eligible household, a family of 4 making about $40,000 a year. So that family that we saw at the beginning of the presentation, they are eligible for 3 Squares Vermont to help subsidize their food budget. The average monthly benefit for a household is $250. So if that family of 4 got $250, it's an excellent supplement for their food budget, but it very rarely covers the whole cost. However, we talk all the time to families who are using their food stamps as their whole food budget. So it's another way that people are really trying to make it stretch. A really great development in offering 3 Squares Vermont is benefits can be used at farmers markets and in some cases with your CSAs, where the CSA piece is a new part of our farm bill that just passed. So we'll be working with our CSA programs to help set that up, and with partners like NOFA Vermont and Vermont Feed on making sure that we can offer CSAs and maybe offer them in new creative ways to families. At farmers markets, you can use those right now. There are the farm to family coupons. There's a great what we call double buck program. So if you bring your 3 Squares Vermont to a farmer's market, you can swipe your card and you can get double the amount of benefits to buy extra fruits and vegetables. So we're really working hard to have more programs like that available at farmers markets, because if you think about it from a whole other side of this issue, there's $11 million a month coming into the state of Vermont in 3 Squares Vermont benefits. That could be great if you spend it at the farmers market and really help prop up our farms and help prop up our local economy. So we want to help get people connected to local food as much as possible. Seniors have the lowest participation in this program, and we're working on that. senior hunger has really developed into a pretty severe problem, and I think we're almost on the verge of a crisis. We have a very large aging population in the baby boomers right now, and they have they're some of the lowest participating folks in the 3 Squares Vermont program, and also very at risk for hunger when you do an age breakdown. So the great thing in Vermont that Vermont did years ago was we were grandfathered into a waiver we had that allows households where if everyone is over 65 in the household, they can get a cash benefit for their 3 Squares Vermont. And the great thing about that is seniors can then use that as their donation for Meals on Wheels. They could, instead of navigating the technology with the EBT card, they can give a check to someone else to shop. They're offered more flexibility. So we have a lot of work to do. Only about 30% of eligible seniors participate in the 3 Squares Vermont program for a number of reasons, and that we're trying to help seniors navigate. But it's really important that we help more seniors get enrolled. So the last part of the formula, the Learning Kitchen. This is a 6-week series of cooking and nutrition education classes targeted towards kids and families who receive 3 Squares Vermont. This is a program we've run. We've run for about 15 years. And in TLK, participants are getting about 12 to 15 hours of class time learning to cook from scratch from really simple, affordable ingredients. We even do a shopping trip to help folks make their shopping list and look at labels, and also look at unit prices to make the best choices, and also understand really basic nutrition concepts in order to make healthy choices in today's food environment. So there's so much, we all see it, there's so much marketing saying this is a great source of whole grain. I saw that on a box of Pop-Tarts the other day. No, my Pop-Tarts, you know, because I don't always buy Pop-Tarts, but I was having a Pop-Tart moment, and I bought some Pop-Tarts, and on the side of the box it said, this is a good source of calcium. And I thought, there's no way this is a good source of calcium. How much calcium is in my Pop-Tarts? And it was not even 10% for a 2,000-calorie diet. So it's those types of it's that type of education that we help people get past those hurdles and really know, a really good source of calcium is milk. And we need to make sure we have a good source of vitamin D along with that calcium. So we provide really basic nutrition concepts so that people can navigate the grocery store. We've had over 7,400 participants since 1998. And we're getting really good long-term results with this program because we have a survey that is evidence-based that UVM helped us design, and we've been using that survey for many years. And then what we do is 3 and 6 month follow-up. And what we're seeing is people are eating more fresh fruits and vegetables every day. They're eating fruits and vegetables as snacks more often, and they're eating a bigger variety of vegetables. So this is one of the most important ways to really help families introduce new foods into their diet and also find ways that are easier and less expensive to feed their families. So the last piece is advocacy. This is a really key part of our job because we feel like to change systems, you have to change them at the highest level and have one of the most strategic interventions, which is changing laws, systems, funding streams that make programs accessible to Vermonters. So this picture here is of Governor Shumlin signing our school lunch bill last year, which, as I said, has made a huge difference in the lives of many kids who are falling into that reduced price category and not eating meals at school. So we're working really hard to be a catalyst for positive change in Vermont and in the country. We do a lot of collaboration at the national level with other anti-hunger organizations. For example, Vermont just inspired Minnesota to pass a law that made reduced price meals free for all kids. So we're really proud of that and worked closely with Hunger Free Minnesota. And a lot of times what we do in communities that's not, at the more Vermont level is we're the backbone organization that brings people together who want to do something about hunger and malnutrition. And I'm guessing that at least someone on the webinar or here has been on one of our hunger councils. And the hunger councils are groups that come together in counties with Hunger Free Vermont, pulling them together, recruiting them members, helping them be successful, to look at what big problems are in that community and solving them together. So a great example is our newest Hunger Council is in Addison County. We sat down with a group of 50 movers and shakers in Addison County and looked at a map of the county. And there was 5 towns that offered no summer programs at all, but were eligible. And now they have taken that on. They have an organization looking at a food truck. They've expanded their sponsorships in other towns to satellite meals to those areas. And each county is different and unique. We're all Vermonters, but the way that Chittenden County solves the problem is very different than the way that Lamoille County would solve a problem. So we're working really to ask the communities what will work for you and your citizens and help us adjust our models to make sure that works, and then deputize them to solve the problems themselves. And in every area we have a Hunger Council. We've seen participation in all the federal nutrition programs really rise significantly. So we're going to continue to expand that model. Hopefully next year we're going to take it statewide. So, and we get it done. We're really, I think to really make change, you have to be really persistent. So unfortunately, maybe some of you are state employees on the phone. You know this about us, that we do tend to be professional nags. I always say we're the nicest people who will bug the heck out of you. But because you really have to stay focused and be really persistent to solve this problem. Hunger's been around a long time, and it's still with us, and we cannot give up the fight. It is a long marathon, but we make significant progress every year. Even though it may seem small, we're making really big impacts. And Vermont's leading that charge. Like I said, we inspire other states when we make those big leaps to do good in the country. So that is the end of my presentation. I just want to thank all of you for your interest in this. I welcome questions. This is our very talented staff board volunteers at our Hike for Hunger, which is coming up on September 27th. So if there's anything you'd like to do to support Hunger Free Vermont, Hiking for Hunger is a great way to do that. And thank you. I welcome your questions.
So thank you so much, Marissa. We have lots of questions. The first is just a comment followed by a question. The sociologist Janet Poppendike argues that the proliferation of emergency food programs indicates a failure on the part of society to deal with the root causes of poverty. You spoke a little bit to this, but how would you respond to Poppendike's comments?
Well, first of all, Jan's a friend of mine. She was just in Vermont last week, and she has her first book about bread lines is coming back out. So I would encourage that person to look for her book. It's called Bread Lines Knee Deep in Wheat. But if you read, so when you read Jan's book, her point is that what happened is, especially through the 1980s, we were, this webinar series is about the war on poverty. So anti-hunger programs and anti-poverty programs were put into place, and through the 60s and 70s, we saw them working. I mean, we really saw them working. The goal was to cut poverty in half. We saw them working. And then when we got to the 1980s, it was an entire shift in policy and funding streams. And we started to defund programs that really worked. And that happened, those of you who grew up in the 1980s may remember Ronald Reagan saying to the School Lunch Association, hey, we can't afford fruits and vegetables. And he said, well, ketchup's a vegetable. So when we cut back on that funding, we started to see more hunger and more poverty in our country. And then what happened was our wonderful churches, social organizations tried to meet the need. And it is too great a need. We need to really invest at the governmental and programmatic level and get back to our roots on this plan to end poverty so that people can really have a leg up.
Just to extend that a bit, are there so she talks about limitations to the emergency food system. Do you think there are limitations to the federal food and nutrition programs as well?
I do think there's limitations as they exist right now. So, for example, that's why we really believe strongly in going to a universal meal model in schools. We think it is very limiting and not fair to children or their families to segregate children by socioeconomic class in one situation in their school day. It really sets up a category for the rest of their life, which is why we believe going to a universal model could really work well. Another example, I think, that is limiting with the federal nutrition program is that what you're getting in food stamp benefits has not kept up with the cost of food or the cost of living or all these other expenses. So people need adequate resources to buy food, and they are relying heavily on the food stamp program. So we need to invest in these programs. Unfortunately, the discussion at the federal level has been how do we cut them or use money from them to save, to help our deficit. The priorities there are wrong.
Thanks, Marissa. This one comes from David. Who should we contact at Hunger Free Vermont to work together on the child care food program issues?
Fantastic. You should talk with Jenna Whitson. She's on our child nutrition team, and her primary expertise is the child and adult care food program. She knows the regulations in and out, and she will do everything from helping you fill out the application to contacting the state on your behalf.
Great. This is a comment and then a question. I applauded my school when they decided to offer free breakfast to every child. Then my child came home and told me that his breakfast was chocolate milk and a cereal bar. What kind of breakfast is that? I question the quality of school meals when the federal reimbursement system is so low. School expenses are already so high and access to community purchases are poor options. How do we address the quality of meals?
I think that's an excellent question, and I'll tell you first that the federal government is addressing the quality of meals. The way they've done that is they've set up, with the Institute of Medicine, new guidelines for the school meal program. So the guidelines for lunch already went into place years ago, and that's going very well, and that requires a school to serve more fresh fruits and vegetables. Every product on the plate has to be whole grain or whole grain rich, lean protein, and it doesn't get chocolate milk off the plate, but it has to be fat-free. So it's taken a lot of calories also out of the meal, which has been very positive in most situations. There are new guidelines being implemented this year for school breakfast, which will require fresh fruits, a fresh fruit in every meal, whole grain or whole grain rich. The problem is, and the person who asked the question really got to this, is the reimbursement rates. So now that the child nutrition reauthorization is coming back up, our primary focus on school food is get the schools the money they need to really provide this quality food that everybody wants and kids will eat.
Thank you. This one comes from Andrea. How have the schools that have adopted the CEP, Community Eligibility, provision added to or corrected their direct certification lists? You might want to talk just quickly for others about what that direct certification is.
Absolutely. So just a reminder, direct certification is when direct certification exists for every school. It's when your family receives 3 Squares for Vermont or Reach Up. The children in your family, the names are sent directly to the school to be enrolled in the school meal program. There are schools, we don't have any schools on CEP yet. It just became available in Vermont, and by just, I mean June 1st. So there will be schools coming up this school year who are going to offer CEP. For example, I know for certain that, not Rutland, Winooski, and I believe Rutland is seriously considering it and possibly moving forward to it, are going to start offering CEP. But it's a really good point that you have to make sure your direct certification lists are accurate. And I feel very lucky to have partners like Paul Dragon here who we can talk to and help make the lists accurate, because there have been some issues because the list comes from the Department for Children and Families and is sent over to the Agency of Education. So making sure those lists are accurate are going to be essential in ensuring that CEP works well for the schools. So what we do is we're going to bug Paul, and we're lucky that we have such a dedicated employee like Paul, and then also work directly with the schools to look at the lists and help ask follow-up questions to make sure the lists are accurate.
Great, thank you. This one comes from Andrea as well. Does Franklin Grand Isle have a Hunger Council, and if so, who is in charge?
We don't have a Hunger Council in Franklin Grand Isle, but you're like at the very tippy top of my list for a lot of reasons. I hope people will keep their fingers crossed for us. We have a funder who invited us to apply for a grant to actually add staff capacity. That's why we don't have a Hunger Council everywhere, as we sort of hit our staff capacity. But we are going to hopefully be taking the Hunger Council model statewide in the next, we have a 2-year plan. So it would start next year if we're able to get the funding source to have the staff. And Andrea, if you would like to be the contact in your community for us to get that up and running, please email me, because that's what we need too, is anchors in the community that will help us open their contact list to get these councils going.
And could you briefly just speak to how would you define hunger, and how would you measure hunger?
Well, I'll tell you how the federal government defines and measures it. So the federal government will not say hunger. They will say food insecurity. That is the official terminology. We call it hunger and malnutrition because we know that's what it is. But food insecurity is defined as a family does not have enough financial resources to meet their daily nutritional needs. And the way that they measure it is every year the USDA contracts with the U.S. Census to do a phone survey. So they call, thousands of American households and first they ask 8 questions, and they're food security screening questions. If there's children in the home, or they respond positively to 3 questions in the first 8, they ask another 8, so 16 total. And then they get the measure of food insecurity, whether you fall into the food insecurity category or the severe food insecurity category. And then the nation has a measure. The state numbers are a 3-year average. So only in the last year or so we felt like we had accurate numbers, because starting in 2009 we had mostly pre-recession numbers, and then as we went on we only added 1 year of recession numbers for the 3-year state average. Now we feel like we have pretty solid numbers for the state.
That was another question just about the survey. Do you feel that is a valid tool or the only tool to gauge hunger?
I really trust the U.S. Census. I'm not a statistician myself, so I do trust their data. The Food Research and Action Council does another measure called food hardship every year. So what they do with that is through Gallup. They contract with Gallup, and they call families, but they only ask one question of it. At any time during the year, did you have a hard time finding food or having access to food? And then it's a yes or no question, and then we get food hardship numbers. I think that's very interesting because it's more, I think the Gallup numbers take a temperature of how we're doing in a moment, like in a point in time in our country, but I do think the census numbers are probably the best data we have right now. But if you ask any school food, if anybody works in school food, you ask them, they say the numbers are wrong in the wrong direction. They'll say, oh, 1 in 5, are you kidding me? I have 3 in 5. I have 5 in 5 kids coming with not enough access to food or enough access to good food on a regular basis.
We have a lot of folks on the phone who are working in the social services, so how would they know if somebody is hungry, and are there screening tools that we should be using?
There are screening tools, and we offer actually, we have a screening algorithm, especially if you are working in any kind of clinical setting. We have a screening algorithm to help assess your food security in the home and then provide resources. We also offer a free online course for medical professionals and clinicians, but it's really, and also folks working in social work, to go online and take a 1-hour course that helps you learn to screen for hunger and malnutrition and then offers resources. You can also, if you're a nurse or a social worker, can get continuing education credits for that course for free through Hunger Free Vermont. And that's right up on our website, so I would encourage folks to go take a look at that.
Thank you. How do you respond to folks who point to abuses with food stamps or think that food stamp recipients should have restricted purchases or are wasting their food stamps on steak and lobsters, which is in the news, expensive organic food, or potato chips and soda?
I respond a couple ways. So first of all, I really rely heavily on data, and there's a number of different organizations, including Walmart, for example, who actually track purchases, what people are buying with their food stamp benefits. And for example, Walmart, I went to a presentation with Walmart. They're the largest grocer in the country, and they had said, we know what people are buying with their food stamps because we track it. The number one things they're buying are milk and bananas. The USDA also tracks purchases, and for the most part, people are buying, it's something like 93% of the purchase that people make with their food stamps is whole grains, fruits and vegetables, dairy, and lean protein, and then only 7% falls into that category of buying, higher fat foods, and I talk to a lot of food stamp recipients who say, you know, we save our food stamps for the things we really need. Like if I only have a little bit of money, then I'll buy the ramen noodles. But if I have, you know, the 3 Squares Vermont benefits, I'll save that and I'll buy my milk and my bread and my eggs. And so that's what I would say. I rely really heavily on the data. The other thing, too, is in my role at Hunger Free Vermont, I think many of us at Hunger Free Vermont just don't feel like just because you're poor and using a public benefit that you should have somebody telling you how to eat. Certainly, one woman told me once when she was on 3 Squares that she had a cake mix and some frosting in her cart, and she could just see the eyes on her because people knew she was using her food stamps, and she was making her daughter a birthday cake. They don't eat that on a regular basis, but she was making her daughter's birthday cake. And shouldn't people, even though they're struggling to buy food, be able to have use food in the same ways, to celebrate, to, you know, to show love to one another. So, so we do not take a position at all on restricting what people can buy on their food stamps.
Thank you. So here's a comment. This is an argument for universal school lunch. This person says, I'm a single mom of 2 teens. When I received the anniversary $1,000 raise at my workplace, which made me no longer eligible for reduced lunch, I found that I actually went backward in my household total earnings. School lunches cost $350 a day per child, nearly $150 per month for my 2 kids, totaling $1,800 a year. So much for my raise, this person says. The benefits cliff on school lunch help is way too steep for working single parents. Hooray for the push to universal school lunch.
Yeah, all I can say is, like, right on, sister. And I talk to a lot of parents also who say, I have no problem affording the $350 per day for my kid, but I am really busy. If I could bring my child to school and not worry about having to pack a lunch in the morning, or if I could have just one less thing in my bandwidth of a busy adult who cares a lot for my kids by taking them to school and knowing they have a good, healthy breakfast and lunch, let's do it. And it just won't cost us that much. And in the long run, it's going to save us a lot of money in the healthcare costs and the education gap by not feeding our kids well. So right on. We're working on it. We promise.
So there's partners and there's organizations working in the charitable food system, and then others in advocating for the federal and nutrition programs. You're coming at it from different ways. What is Hunger Free Vermont doing to bring all the partners, including the food bank, together into a common voice?
Yeah, it's a great question, and I actually think we all are really aligned. Like I said, whenever I talk to anybody in the charitable food system, they just say, we can't meet the need, and what we need is more people having regular access to food. So the more we can do to ramp up school meals, to ramp up child care programs, and making sure people have their 3 Squares Vermont, the better, because the charitable food system is doing an amazing job getting food to people. They just know they can't meet the whole need. So I actually think we're really aligned on that, and the reason I know that is really because of the Hunger Councils. We bring together the food bank, the CAP agencies, the philanthropists in the community, and we have, you know, heads of local banks who are on the Hunger Councils, because they all care, and we all really believe that there needs to be, you know, one root cause solution to this, and to work together on that. So one thing that Hunger Free Vermont does exceptionally well, it's probably one of the things we do best, is we're a really great convener of all the groups working on this issue and doing anything we can together to really solve the problem.
Great, thank you. Another question. Tens of thousands of Vermont families receive 3 Squares Vermont. Is a 6-week series of cooking and nutrition classes scalable? Is it a scalable model when only 7,400 people have participated since 1998? I wonder if there are other ways that we can address food choices among the general population. I'm not sure that bad choices are specific to low-income people. What are some other ways to see us addressing the issue?
Yeah, I really agree with that question, and we've struggled with it, you know, because it's expensive to do nutrition education in the model that we're in, and we have worked really hard to make it financially sustainable. And we got to the point where we just really said, this is the point that we just can't give up on. You know, it just takes this many resources to do a really good job at this and see behavior change. But exactly to your point, we've had 7,400, which we think is a great success, but it's not enough, 7,400 people participate. So I think there is a lot of opportunity. We've tried to scale the program so that we have an activity bank for school, child care centers, summer programs, anybody who would like to use elements of our Learning Kitchen curriculum to download a one activity session that you could maybe do, you know, in other arenas. I agree that that's also not a low-income issue, you know, of food and nutrition. For example, one thing I personally have learned from the Learning Kitchen is how to buy a whole chicken instead of buying cut-up chicken and cut it yourself. Unless somebody teaches you those knife skills in your household, you're not going to know how to do that, and we really have the ability to teach people that. But we do need more resources like that, and I think what we'd like to do is really continue to work as a partner and, you know, provide curriculum wherever we can and provide support so that we can keep it going.
Thank you. We're about to close, so what's your advice for folks on the phone if they could do one or two things that help advance the cause of food security in Vermont and around the country? What would you suggest we do?
You know, the first thing I would say is, I hope simple, but to consider changing your mind about who is food insecure in Vermont. I mean, I think I've painted a picture that you know someone who's food insecure right now. This is not an isolated problem. It's pervasive. It's epidemic. And I think many people have, because this has been ingrained in us, we have a mental model of who's using food stamps, of what kids might be on free and reduced price meals, and to have a shift that those programs are likely programs your friends and neighbors are using, and they just don't deserve judgment. It's one of the #1 reasons people don't participate in the Three Squares Vermont program. They are worried of the stigma and the judgment in the grocery line. So I'd say, if you can, change your attitude. The other thing I hope people would consider is, you know, making real system change is most successful when our leaders know there's a lot of people behind the request. So if you feel really passionate that we should, you know, continue to move towards universal meals, consider dropping an email to the governor, who is incredibly supportive of this work. But if he's going to continue to be our hero and continue to be our champion, he needs to know he has the community support. And the same for our congressional delegation. They are responsive, they are committed to nutrition, and they're working in a really difficult environment right now in Congress to make change to these programs that are necessary and to provide funding. And they need to know they have the support of Vermonters to really stick their neck out on behalf of our state and behalf of our country. So just consider dropping them a line as well. So those are my top 2 things.
That's great. Thank you so much, Marissa. We appreciate you coming here, giving us your perspective. Thank you, everybody on the phone, for the great questions. And please don't forget to join us July 31st at noon, when we'll be discussing asset as it relates to poverty and how we can help build some strategies to help families build financial security. So have a great Thursday, everybody, and we look forward to seeing you July 31st at noon.